Have you, or maybe someone you know, ever suffered from a chronic, agonizing autoimmune disease where the doctors just couldn't pinpoint a root cause? It's an incredibly frustrating reality for millions of people today. Well, welcome to This Explainer. Today, we're unpacking a truly fascinating and, frankly, highly speculative medical mystery. We're exploring a bold hypothesis drawn directly from our source material, one that actually tries to connect a 120-year-old, basically forgotten cancer treatment to some of the absolute most complex and seemingly incurable chronic diseases we face right now. So let's dive right in and see how a deadly bacterial infection was actually once used as a weapon to heal. Here is our roadmap for today. We're going to cover the William Coley enigma, the 600 strains problem, the tree root metaphor, the hypothesis of dry internal erysipelas, the 3 factors of healing, and finally, a call for new research. Okay, let's kick things off with Section 1, the William Coley enigma, a 120-year-old medical mystery. I want you to picture what the medical landscape looked like 120 years ago. According to the historical data in our source, a doctor named William Coley developed a super controversial cancer treatment at a time when literally just getting scratched by a rusty nail could be a death sentence. We're talking about an era long before standard microbiology, before genetics, or even basic antibiotics, which, wouldn't even arrive to save the day until the 1940s. Fast forward to today, and the author of our source material is actually pulling Coley's long-forgotten work completely out of the medical archives to formulate a brand new modern hypothesis. To really wrap our heads around this enigma, we first need to define what exactly Coley's toxins were. Essentially, this was a super early attempt at immunotherapy, using a deadly bacteria. Yes, you heard that right. Coley decided to fight cancer by intentionally injecting his patients with a lethal infection. He created a vaccine using killed Streptococcus bacteria, specifically the kind that causes a really severe disease called erysipelas. He called this concoction Coley's toxins because he believed the killed bacteria released toxins that would provoke the patient's own immune system into launching a massive, full-scale attack against their cancer. Now, erysipelas itself is a brutal, rapidly spreading bacterial skin infection. A century ago, it was incredibly common and incredibly dangerous in hospital wards. But our source shares this truly remarkable historical anecdote that kind of kicked off this whole journey. Doctors started noticing that cancer patients who accidentally caught erysipelas sometimes saw their tumors miraculously shrink. There's this one jaw-dropping case Coley mentioned. A young girl with a massive, inoperable facial tumor was placed in a hospital bed that had just been occupied by an erysipelas patient. She inevitably caught the infection, the bacteria raged completely across her face, but within 2 months, her tumor was totally gone. Coley witnessed this absolute medical marvel, had a massive eureka moment, and decided to weaponize the infection. And wow, weaponize it he did. Coley would inject these massive, elevated doses, sometimes daily or even twice a day, directly into the tumors or the bloodstream of his patients. He just relentlessly increased the dosage until the patient's body temperature spiked to a scorching 41 degrees Celsius. To put that into perspective for a second, 41 Celsius is about 105.8 degrees Fahrenheit. That is a medical emergency that would land any of us in the ER today with alarms blaring and ice baths waiting. But Coley was pushing the human body to the absolute brink of a thermal crisis entirely on purpose. The result of this extreme thermal crisis is where things get really, really wild. The author highlights that, despite using crude, totally unstandardized technology by today's metrics, Coley reportedly achieved a 50% to 75% success rate. And remember, he wasn't treating early-stage, easy-to-manage cases. He was treating stage 4 terminal patients, people who had totally exhausted all other primitive options like early radiation and surgery. These were patients whom other doctors had entirely given up on. Honestly, a 75% success rate for terminal patients even today would be considered an absolute miracle in modern oncology. Which brings us to Section 2, the 600 strains problem, a shape-shifting enemy. So the obvious question is, if this treatment had up to a 75% success rate in terminal patients, why on earth didn't it become the global standard of care? Well, the answer lies in the shape-shifting nature of the enemy itself. The source notes this amazing piece of research where a scientist once tried to categorize all the different strains and mutations of this specific group A Streptococcus. She got up to 600 different strains, and then she literally just threw her hands up and quit. The bacteria is just incredibly mutagenic. It's constantly adapting and changing its armor. The author compares it to modern viruses like COVID, where a targeted drug that works flawlessly on the first variant might do absolutely nothing to the next one. And this illustrates a massive modern medical dilemma. When you use standard antibiotics, you might successfully wipe out a specific, weaker strain of this bacteria. But against severe, aggressive mutations, standard antibiotics often just fail completely. The source even points out a really surprising irony here. In pig farming, there are actually highly successful standardized vaccines and serums for animal erysipelas. Yet for humans, we still just throw standard antibiotics at it and kind of hope for the best. Coley's vaccine, on the other hand, didn't just target a single specific strain with a chemical. Instead, it provoked a massive, systemic, high-fever immune response. It effectively turned the patient's entire body into a completely hostile environment for the disease.
Moving on to Section 3, the tree root metaphor, folk medicine's partial fix.
When standard medicine and antibiotics fail against aggressive erysipelas, our source notes that desperate patients often turn to alternative methods just out of sheer survival instinct. In places where modern medicine comes up short, people sometimes visit traditional folk healers, often called babkas, who use these seemingly unscientific methods like prayers, whispered words, or red cloths. Strangely enough, the active, aggressive skin infection sometimes actually stops, but the author uses this brilliant tree root metaphor to explain the pretty dangerous reality of what's actually going on here. Folk remedies, much like a failed or incomplete course of antibiotics, might stop the aggressive, visible growth on the surface. They successfully cut the top of the tree, so to speak. But the underlying bacterial roots, the core of the disease itself, remain alive. They just sit dormant deep in the dark, nutrient-rich soil of human tissue, just waiting. Which leads us right into Section 4, Hypothesis, Dry Internal Erysipelas, the hidden root of chronic disease. That lingering invisible root system forms the entire basis of our source's central and, again, highly speculative grand hypothesis. The speaker proposes the existence of something they call dry erysipelas. Now, this is a hypothesized internal, highly adapted version of the bacteria. It is mutated so perfectly to match the host's human tissue that it becomes practically invisible. Imagine the profound psychological toll this takes on real patients. You're feeling chronic, agonizing pain, pulling, or severe discomfort, only to sit in a doctor's office and be told that your blood tests are completely normal, ultrasounds show nothing, x-rays show nothing. The bacteria is effectively hiding in plain sight, totally mocking modern diagnostics. So what is this invisible bacteria actually doing while it's hiding? Well, the author's hypothesis suggests this hidden dry root is masking itself as a wide variety of modern, supposedly incurable conditions. Depending on where this invisible bacteria settles in the body, it could be the underlying trigger for diseases that completely alter the trajectory of a person's life. We are talking about severe autoimmune diseases like multiple sclerosis or lupus, devastating types of bone cancer like sarcoma, mysterious unexplained nerve pain, and even certain psychiatric disorders. The author notes a really tragic missed opportunity here. William Coley's daughter actually wrote 19 extensive monographs on his work, but the scientific community never really bothered to study the vaccine's potential effect on these debilitating neurological and autoimmune conditions.
All right, Section 5, 3 factors of healing. How the vaccine allegedly works.
If we entertain this bold hypothesis for just a minute, we have to ask, how did Coley's extreme vaccine actually fight these deep, invisible bacterial roots? Based on the source's analysis, it was basically an all-out microscopic war that relied on 3 crucial steps acting together. First up, bacterial competition. Coley used the most lethal, aggressive strain of the bacteria he could find for his vaccine. The author likens this to the discovery of penicillin, where a strong fungus simply outcompeted and ate the weaker surrounding bacteria. The aggressive vaccine strain violently displaces the weaker, mutated internal chronic strain. Second, this invasion triggers a massive, overwhelming production of targeted antibodies. And third, the pyrogenic effect. That blistering, deliberate 41 degrees Celsius fever literally burns the disease right out of the body. It is the combination of these 3 intense factors that allegedly achieve those incredible cure rates in terminal patients. And finally, Section 6, a call for new research, looking to the future. The speaker here doesn't just want to tell us a really interesting history story. They strongly advocate for rescuing this concept from the forgotten pages of medical archives and bringing it right into modern clinical labs. The source outlines a few proposed modern interventions. First off, science needs to successfully isolate this elusive dry erysipelas bacteria in a pure form. Once it's isolated, the author suggests we could actually develop highly targeted localized injections.
Imagine a targeted strike, kind of like Botox, but instead of smoothing out facial wrinkles, it paralyzes and destroys a hidden bacterial lesion deep in the tissue. Furthermore, they advocate for creating a modern, standardized human vaccine. Not just for treatment, mind you, but as a preventative measure for those with a genetic predisposition to cancer or these autoimmune diseases, much like how we routinely vaccinate against tetanus or the flu today.
Now, this next part is wild. The author is so deeply convinced by this hypothesis that they actually propose the ultimate radical self-experiment. They suggest intentionally infecting their own lingering internal dry lesion with a live, highly aggressive external red erysipelas bacteria. The theory being that the strong, aggressive flesh-eating strain will completely outcompete and consume the weak, chronic strain, allowing the body's immune system to finally clear the entire infection all at once. I mean, it's an absolutely shocking proposition, bordering on madness to our modern sensibilities, but it really underscores just how strongly the author believes in the mechanics of bacterial competition.
So while the author's theory of dry internal erysipelas is undeniably speculative, the historical reality of William Coley's staggering successes is a matter of documented record. If a 120-year-old abandoned treatment holds even the slightest speculative clues to curing the modern chronic diseases that plague millions, what other forgotten medical anomalies are we ignoring today? It is a truly fascinating look at how the medical mysteries of the past might still be hiding in plain sight, just waiting for modern science to finally take a second look. Thanks so much for joining me on this explainer, and keep questioning what you know.